I'm Dr. James Nill, Nill Family Chiropractic and Wellness Center, and today we're going to talk about ankle pain. Now, the majority of ankle pain comes from somebody that has a sprain in the ligaments in the ankles, which a lot of times it's mostly the lateral segment and sometimes the medial segment here. What happens when an ankle sprains is that the muscles on the outside weaken to the point where the ligaments is the only thing that are left, and it stretches those ligaments and causes that swelling to try to protect that joint. But there is a therapy for that. Right away we want to do what's called RICE, rest, ice, compression, and elevation. So put ice on it and compress and elevate it. You can do that, or I've learned to actually treat myself by stimulating the weak muscles to try to help guard this ankle, and it'll release pressure on those ligaments and you get back right out and start playing again. So first what I'm going to do is put a little therapy on here to help try to decrease that swelling, and what's going to be called anodyne therapy. What we're going to use is what's called anodyne therapy, which you can see here. These are little bitty lights that come out here, and what it does is it releases 890 nanometers of light, which gets attracted by and absorbed by the red blood cells. That, in a sense, releases nitric oxide from the hemoglobin, which is a natural vasodilator, and what that does is opens up all the lymphatic and blood vessels in the area to drain out any inflammation caused by the ankle sprain. So what we'll do is we'll actually put this strap around, keep it on the pain source. For him, we're just demonstrating that the pain might be a high ankle sprain with him, but we also want to help out with some of the foot problems down here. Now I'm going to let this sit here between 8 and 15 minutes, depending on how long we need it on there for, and then we'll move on to the next part of the therapy. Now, next thing we want to do is we want to try to stabilize this ankle. Now, every joint in the body has a set of muscles that help stabilize it or cause it to its core musculature. The main one that you're probably familiar with is a rotator cuff. So if one of these muscles goes out, we're going to have other muscles are going to have to work twice as hard to help make up for it. So what we do is agonist and antagonist therapy, and also origin and insertion therapy within that muscles. So we're going to actually get real deep in here, and unfortunately this does not feel real good, and it'll actually help wake that muscle up. And then we also work on the tight ones and try to cause it to go down too. So I work on both sides, and there's a little sling that comes around, and it'll actually help stabilize that ankle, and eventually the pain will go away. When I'm done with that, I do a little foot and ankle manipulation here to try to release some of those restrictions in the tight muscles. Come again, and then we do some therapy. Go ahead and push your foot up. Push it. Nope. I'm going to nope. Go this way with your foot. Resist me. Relax. Okay, push it down. Push your foot down. There we go. Relax. Push your foot up. Relax. Do it again. Relax. And then that way we kind of help strengthen the different musculatures. And we do that for about 8 to 15 minutes